name is Sarah Arney, and I am a Doctor of Physical Therapy student at Indiana State University. Today I'm going to walk you through a progression that I'm going to use with my patient Don in order to achieve his goal of ascending and descending the staircase to his apartment with a lower rating of perceived exertion. So first we're going to start with some standing high knee marches. So one thing to look for is I want to see 90 degrees at the hip and 90 degrees at the knee, and then we're going to alternate. You can use this chair for balance, but I don't want you to use it for support holding yourself up. All right? I'm going to have you do that until you get fatigued, too tired to continue, and then you'll take a sitting break and then do that 3 times. Right? Another way we can progress this as it becomes easier for him to do and he's able to tolerate more activity would be by adding ankle weights or resistance bands to his ankles to increase the force that he has to push through in order to achieve this movement. Our next progression towards reaching Don's goal of climbing the stairs will be mini squats. So to position yourself for mini squats, we're going to have our feet shoulder width apart. You're going to stand in front of a sturdy surface. So I'm using this chair. You can also use your countertop or kitchen table. And you'll hold on just for balance. I don't want you pulling your weight off of it, okay? And we're going to go down about halfway. So I don't want you going 90 degrees, but about halfway between that and standing. And you're going to focus on having your knees go over your toes. So I don't want them coming in or going out. Go straight over your toes and keeping your body in line. So I don't want you sticking that booty out. We want to think of going down as one unit. So you can try. Good. And I'll ask him to do this until fatigue, and then we'll do that 3 times with the sitting rest in between. And as he becomes more comfortable with this activity, we can increase the difficulty by adding resistance bands around his knees or changing the surface in which he is standing on. This next activity we're going to do is foot taps onto a short step. So I have this chair positioned here so you can hold on for balance. But again, like always, I don't want you putting weight into it. It's just to help keep your balance. And first we're going to just tap the heel onto the step. And if you're able to do that well, we'll add a weight shift into it. So this is to get you started for shifting as you climb the stairs. Good. And when we're doing this, we just want to focus on making sure you're clearing the step as you do it. So you're doing a great job going up and over rather than kicking the step. And now we can progress to that weight shifting. And I'll have Don do this until fatigue 3 times, again with the standing or sitting rest in between. And we can progress this with higher steps and then also multiple steps as well. So our last progression, moving towards climbing the stairs, would be actually using a step to step up on. So you'll stand in front of the stairs. You can use a railing for balance or support. Again, I don't want you putting a significant amount of weight on it. This is just to keep you safe so you don't fall. And you're going to step up onto the step. We're going to tap our toe on the second step and then come down. And then you'll switch, so you step up with the left, touch with the right, and then come back down. And we're going to keep switching, and you'll do this until fatigue and with a rest in between. And one thing that we're focusing on here is getting that reciprocal foot movement so that when we progress to actually having a stair climbing program, he does it with good form.